Tuesday the 1st of September seen the launch of a new vaccine helping to prevent infection for the meningococcal group B bacteria for babies being born from this date. Dr. Richard Smithson from the Public Health Agency is here to talk to us today and tell us more information about the vaccine. Richard, can you first of all tell us what the normal childhood vaccination programme is?
Well, we vaccinate babies and young children against a wide variety of diseases, and as a result of that, these have all almost completely disappeared from Northern Ireland. We start vaccinating at 2 months of age and give babies vaccines at 2, 3 and 4 months of age, and that covers things which are maybe long forgotten to some parents, like diphtheria and tetanus and polio. And we also have seen more recent vaccines such as against the meningococcal group C, pneumococcal, more recently rotavirus infection. Then, just after the first birthday, we give boosters for some of those, and we also protect against the measles, mumps and rubella infections. And then again at about 3 years and 4 months, we give boosters to some of those vaccines to make sure that children are protected right through childhood and into adult life.
And I know you briefly talked about it, but can you tell us about this new vaccination and who it's aimed at and what it's going to be protecting against?
Right, well, the new vaccine, which we're very excited, is being introduced across the UK, and the UK is the first country in the world to introduce this into the routine childhood programme, is to protect against the meningococcal B disease. Now, we get different strains of meningococcal disease. I mentioned that we have the meningococcal C vaccine. That was introduced back in 1999, and that has virtually wiped out meningococcal C disease. So now over 80% of cases that we see in this country of meningococcal disease are caused by the group B bacteria, and this new vaccine is going to protect against that strain. So is something, as I say, is really exciting because meningococcal disease is really, I think, most parents' worst nightmare, that their children will get it. It is relatively rare, fortunately, but if they do get it, it can be very serious, and so it's something that we want to prevent.
And can you tell us what meningitis is and how it's caused?
The meningococcus bacteria can actually cause a couple of infections. Most people think of them as causing meningitis because of the name. They also cause septicemia or blood poisoning, and often the two can go hand in hand, and they're both very serious. Meningitis is an infection of the brain, and it can, if not treated early, lead to brain damage amongst those who survive. Blood poisoning is actually even more serious than meningitis. It can do things like cause loss of limbs, and can come on very quickly and can actually lead to the death of some babies. It is not that easily transmitted. It is a bacteria that quite a lot of people carry, and it doesn't normally do any harm, but occasionally it does spread from the nose and throat where it's carried into the blood and into the brain where it causes infection.
And with all vaccinations, there are some side effects. Can you tell us some of the side effects and what symptoms parents should look out for?
Yes, we wouldn't want to pretend that there's no side effects from vaccines, but fortunately the side effects we see are not serious ones. So the most common side effect would be a high temperature, just feeling a bit off colour for a few days after the vaccine, pain at the site, redness and swelling. Now, this new meningitis B vaccine does cause more high temperatures than most vaccines, and because of that, we are recommending that parents give their babies at 2 and 4 months infant paracetamol just after the vaccine. That's something like Calpol, and you can get that very easily from any high street chemist, from all the supermarkets stock it. And we would say to parents, make sure you've got a bottle in the house before you take your baby along for the vaccine. Give them the first dose just after the vaccine, then give them 2 more doses at 4 to 6 hourly intervals, and that will help to prevent the temperature, help to stop the baby sort of feeling a bit generally unwell and the pain from the injection. But obviously it's much better for a baby to have a high fever than it is to risk getting this very serious condition. And giving them infant paracetamol will help to make sure that the temperature's not too bad.
And where can people find out more information about the vaccine, or if they have any queries?
Well, they will be given our new leaflets, which have got the information about both all the vaccines that we already give and this new vaccine. But if that doesn't answer all their questions, probably the best thing is to talk it over with their health visitor or their GP, who'll be able to answer any specific additional questions they have.
Thank you, Richard, for joining me in the studio today to talk about this.
My pleasure. Thank you.